Well, the main source of communication that the whole hospital uses is Vocera, kind of like a walkie-talkie system, hands-free. Other than that, our OR Max system is a nonverbal way to communicate patient status, and also the OR schedule, which is really nice to be able to look at that and kind of visualize how the OR is running. And then, of course, paperwork is another nonverbal communication that we use, passing that along as far as handoff report and a way to see what's going on with the patient historically or in pre-op.
We have several ways. Of course, there's always the telephone. We have a Vocera system where we call others in the OR area and ask questions. And of course, we have our little flag system. We actually make post-it notes on the back of charts. And of course, we talk to each other around here locally too.
I think difficulties would probably be just the volume of people that you really need to communicate to about one patient. So, there's a team of pre-op nurses, surgeons, nurse anestheticists, circulators, core coordinators, and although OR Max takes down the responsibility of speaking to each one individually, sometimes that doesn't communicate wholly. So just the number of phone calls that you need to make, that's been reduced a good bit, but being certain that everybody's involved in that communication. Vocera can be frustrating, it doesn't always connect, and I would certainly consider that a difficulty. Less time on communication means time doing the work that's required to get the job done. So I think that's probably the most difficult part, is just communicating to the masses.
Just keeping the information up to date. Sometimes our little handhelds do not work accurately. You spend a lot of time trying to get it to take the information, but much of the time it works okay. And it updates this board here. So these are Vocera system, and most of the time it works pretty well too. I kind of like this also.